Heather Stevens hasn't always gotten good breaks when it comes to her health. Plagued by fatigue even as a child, diagnosed with heart problems years later. She's had a pacemaker most of her adult life.
If it wasn't for pacemakers, I wouldn't be here today.
Her pacemakers naturally needed replacing over the years, but in 2017, infection after the latest procedure threatened her life.
I kept getting sick and the pains in my chest were so unreal.
Heather needed open heart surgery to remove the new pacemaker, its leads, and the infection. That's when the woman whose friends called Ticker finally got a good break, thanks to something called innovative procurement. In Canada's single-payer health system, buying medical products or services has traditionally focused primarily on lowest price. But Southlake Regional Health Centre in Newmarket, Ontario, recently experimented with an approach that supporters say may revolutionize Canadian healthcare.
We were looking for a strategy that would not only achieve value for money, but would also achieve our ability to adopt new innovation in the program.
Under innovative procurement, Southlake was able to consider the value of a product or service in addition to its cost, to examine questions like, does it improve outcomes for patients, help them recover faster, go home sooner, or reduce their risk of returning to the hospital? And Southlake engaged in so-called competitive dialogue, where it might partner with companies like Medtronic's Integrated Health Solutions to find ways of improving operational efficiency or streamlining medical procedures. The savings could then be used in many ways, including investment in new medical technologies. Thanks to the work at Southlake, the Heart Rhythm team was able to implant a leadless pacemaker to help Heather. Because it's implanted without the traditional surgery and has no leads connecting it to the heart, there was a lower risk of infection for Heather. But it's something she might not have received at Southlake under traditional procurement.
This whole process, at the end of the day, doesn't only benefit our institution or our hospital or our ministry in terms of funding, but it benefits the patient as well.
Heather is now back at work and back to enjoying life with her family and friends. She had never heard of innovative procurement, but she appreciates what it's done for her. And she hopes many other Canadians will soon benefit from it too.
To go from feeling poorly to feeling like $1 million, it's priceless. Yeah, come on.